Hi, Dr. Fiorini here. I just wanted to answer a question a patient had about a 3-month care plan that we set up for them. Think of your body like a house with a foundation that has shifted. Now, if a builder comes in and adjusts it just once, it might help a little, but without repeated strategic reinforcement over time, that structure just won't stay stable. And the same is true for your spine and for your nervous system. When someone starts chiropractic care, especially after injury or after years of misalignment, it takes time for the body to adapt and to heal and to stabilize. A 3-month care plan isn't just random, it matches the body's natural healing timeline. Muscles need time to retrain and stop pulling the spine out of alignment. Ligaments and other connective tissue takes weeks to months to years to remodel and to strengthen, and nerve interference needs time to reduce so the body can begin functioning at its best. Just like you wouldn't go to the gym once and expect lifelong fitness, chiropractic care requires consistency to create long-lasting change, and 3 months gives the body a real shot at healing properly. Now, here's some research that are some reasons for a 3-month care plan based on research. And these are very powerful studies and clinical observations that support it. We know that symptom improvement plateaus at around 12 weeks. A study done in the Journal of Spine, its findings said that the study showed that multiple visits over 12 weeks resulted in greater pain relief and functional improvement than fewer visits. Patients receiving 3 visits per week for 4 weeks, then tapering down, saw the best outcomes. And the implication is it takes time and frequency to hit a therapeutic threshold, often around 12 weeks, where pain relief and structural changes start to solidify. Number 2, ligament remodeling takes 12 plus weeks. Soft tissue healing, connective tissue healing, takes time. And the findings of this study were that ligaments and connective tissue take up to 12 weeks or more to remodel and strengthen after trauma or chronic strain. And the implication of this is that a care plan shorter than 3 months doesn't allow enough time for true structural healing, especially if the pain has been under stress or if the spine has been under stress for many years. There was a study done about neurological adaptation after repetitive chiropractic care, physiological therapeutics. Spinal adjustments influence neuroplasticity, which is the brain's ability to adapt and rewire, and those changes are more profound and lasting with repetitive care over time. Implication, you can't expect the nervous system to adapt with just 1 or 2 adjustments. It needs consistent stimulation and correction over weeks and months. Number 4, patient retention and satisfaction with care. Comparative effectiveness of 12 weeks of spinal manipulation, supervised exercises, home exercises for chronic pain. This was in clinical rehabilitation. The findings were the patients who received 12 weeks of care showed better long-term outcomes and satisfaction than those in shorter programs. And the implication is that patients do better and feel better when they stick with care for a few months, and they're more likely to stay well afterward. Now, the conclusion of this is that a 3-month plan isn't just about getting out of pain. It's about giving your body time to stabilize, to strengthen, and to stay that way. The pain may leave early, but the real magic, the correction, the healing, the rewiring takes time. And that's what the research supports. So that's why we do it. Have a great day.